CPR is something we can all learn. It's easy and safe to perform. More importantly, when effective CPR begins immediately following recognition that a person is not breathing, it can save the person's life. It does this by providing sufficient oxygen and blood circulation to keep the person's brain and other vital centres functioning until advanced life support arrives. Cardiovascular disease is the greatest cause of death in the adult Australian population and equates to 26% of all recorded deaths. Coronary artery disease is the largest single cause of deaths, and about half of these deaths every year result from sudden cardiac arrest. A sudden cardiac arrest is the abrupt loss of heart function, breathing and consciousness, and may occur without warning before the person has time to get to a hospital or seek medical help. Importantly, death in these victims will occur if immediate first aid is not given. Time is a critical factor. A person's chance of survival is dependent upon a strong chain of survival in the community. The chain of survival concept describes the critical emergency actions necessary when a collapsed victim is unresponsive and not breathing. This video concentrates on the first three links in the chain: early access, CPR, and defibrillation. To ensure the best chance of survival, the first aider must follow the first aid priority action plan to assess and manage an emergency. Danger. Make the scene safe for you, others, and the casualty. Never place yourself in danger to assist and risk becoming a casualty yourself.
Hey mate, can you hear me? Can you open your eyes for me?
Response. Talk and touch to elicit a response. It's a good idea to place an infant on a table for easy access rather than bending over on the floor.
Chloe, he's unconscious. Can you please call 000?
As the casualty is unconscious, send for help and call 000. Stay on the line, speak clearly, and answer the operator's questions.
Ambulance, please.
Calling for help early is important because in many cases, the cardiac arrest is due to ventricular fibrillation, which is reversible by a defibrillator. The outcome for these casualties is significantly improved when the time gap to defibrillation is short. As every ambulance carries a defibrillator, calling for their assistance first is a priority. Where a workplace or public access defibrillator is available, this should be sent for as soon as possible. Airway. Remember, care of the airway takes precedence over any injury, including possible spinal injury. The casualty should be left in the position they are found to assess airway and breathing, not routinely rolled onto their side unless matter or fluid obstructs the airway. Once the correct head tilt is achieved, check breathing. First aiders should look for movement of the casualty's lower chest or upper abdomen, listening for the escape of air from mouth and nose, and feel for movement of air at the nose or mouth, as well as the rise and fall of the chest. If the casualty is breathing effectively, turn them into the recovery position and ensure correct head position and monitor until the arrival of help. An ineffective abnormal breathing pattern in cardiac arrest is called agonal breathing. It's characterised by irregular, sporadic gasping followed by irregular pauses. It is not true breathing, rather a brainstem reflex. Sounds of gurgling, gasping, sighing or coughing may be present, as well as movements of the chest and stomach. Sometimes chest movements are mistaken for breaths, but these movements are not effective and the person is not breathing normally. If the casualty is not breathing or not breathing effectively, commence CPR.
He's not breathing. I'm going to start CPR.
Remove clothes if possible, as getting down to skin is the best option. To deliver effective chest compressions, it is important to correctly position the hands on the chest. With the child or adult casualty on a firm surface, kneel beside them. The compression point is located on the lower half of the sternum or breastbone. The lower half of the sternum can be found by visualising where the centre of the chest is and placing your hands just below this point. Another way of locating the correct position to compress the chest is by feeling for the point where the lower ribs join in the middle and hands are placed just above this point. Compression applied too high is ineffective and too low may cause regurgitation or damage to internal organs. Having located the compression point, place the heel of one hand on the sternum with the fingers pointing away from your body. Keep your fingers slightly raised to avoid pressure being placed on the ribs. Place your other hand on top of the first, interlock the fingers or lock the thumb around the wrist, again keeping fingers off the chest. For both child and adult CPR, 2 hands are now used for compressions. Press downwards to 1/3 of the depth of the chest through the heel of your lower hand. Keep your elbows straight to allow the weight of your upper body to achieve an even compression and control the depth. Use a smooth, rhythmical action for each compression. Allow for full chest recoil and let your hands or fingers spring back from the compression. Deliver a cycle of 30 compressions and 2 breaths and repeat this 5 times in 2 minutes and continue until an ambulance arrives. For an infant, place 2 fingers in position and press. The depth of each compression is also 1/3 of the chest, the same as for children and adults. If you need to perform rescue breathing, use a CPR protective device like a shield if possible. They're desirable but not essential. The Australian Resuscitation Council emphasises that the risk of contracting an infectious disease by rescue breathing is very low, and resuscitation should not be delayed if such a device is unavailable. After 30 compressions have been given, give 2 rescue breaths. Each rescue breath is delivered over 1 second. To deliver the rescue breaths, close the casualty's nostrils using either your fingers, cheek or shield device. Place your mouth over the casualty's slightly open mouth to create an airtight seal. Blow enough air into the casualty to produce a gentle rise of the chest. After delivering the breath, lift your mouth from the casualty's mouth and turn your head towards the casualty's chest to breathe fresh air into your lungs and listen and feel for air being exhaled from the casualty's mouth and nose, and also to watch the chest deflate. Deliver your second breath the same as the first. With an infant, both the mouth and nose are covered by the rescuer's mouth. An infant will require far less of the rescuer's breath to achieve adequate rise and fall of their chest. Only a puff of air, just the air in the first aider's cheeks, will be adequate. Once again, each breath is delivered over 1 second. If rescuers are unwilling or unable to undertake rescue breathing, they should do chest compressions only. If chest compressions only are given, they should be given at a continuous rate of approximately 100 to 120 per minute. Competent first aiders need to achieve a cycle of 30 compressions and 2 breaths, repeated 5 times in 2 minutes. This will mean around 75 actual compressions and 5 breaths are delivered each minute. CPR can be performed by 1 or 2 rescuers. This all sounds a bit complicated, but really it's quite easy, and with a little practice you will be able to remember how to do it.
Ba, ba, black sheep, have you any wool? Yes, sir, 1 bag full. Ba, ba, black sheep.
The Premium Health CPR method uses a simple song to help you achieve the correct rate and rhythm for heart compressions and allows you to keep track of when to give the 2 breaths.
Ba, ba, black sheep, have you any wool?
Singing 2 verses of the nursery rhyme Ba Ba Black Sheep fits the time required to give 30 compressions.
Have you any wool? Yes, sir, 2 bags full.
At the second verse, the words 2 bags full reminds the rescuer to deliver 2 breaths.
Ba, ba, black.
Whilst the singing of a song in such serious circumstances as cardiac arrest may seem odd, the intent is very serious. The method helps first aiders to slow the compression rate instead of allowing their adrenaline response to speed things up. The correct rate and rhythm are important for survival.
Ba, ba, black sheep, have you any wool? Yes, sir.
Ribs may be broken because the casualty has brittle or fragile bones, or due to the rescuer's incorrect hand position and or pressing too forcefully. If this happens, do not worry. People live after breaking ribs. CPR is life-saving. So if you did hear or feel a rib crack, stop, recheck your hand position and continue compressing to the correct depth. If the casualty vomits during CPR, they should be turned into the recovery position to clear the airway. And if still not breathing, CPR should be continued. CPR should be continued until someone more qualified takes over, the casualty responds, or you are physically unable to continue. If available, a defibrillator should be utilised as soon as possible. A defibrillator analyses the heart rhythm and delivers a shock to the heart of a casualty in cardiac arrest in an attempt to convert an abnormal rhythm back to a normal rhythm. The unit should be turned on and voice prompts followed.
Firmly place the second pad on the other location.
If there are multiple rescuers, the defibrillator pads can be applied while CPR continues.
Do not touch the patient. Analysing rhythm. Shock advised. Do not touch the patient.
Voice prompts should continue to be followed and CPR continued when prompted. As time increases, the chance of successful defibrillation decreases, so CPR should be interrupted to apply a defibrillator in the case of a single rescuer. Where available, paediatric pads should be used for children and may need to be used on the front and back of the casualty. If a casualty begins to breathe normally, they should be positioned on their side and managed as for an unconscious breathing casualty. So, to summarise. Danger. Ensure the area is safe for you, bystanders and the casualty.
Hey mate, can you hear me?
Response. Talk and touch to determine level of consciousness.
Can you reach up and squeeze my hands?
Send for help. Call 000 and send for a defibrillator.
Ambulance, please.
Airway. Check the airway for obstruction and clear if required. Then gently lift the chin upward and tilt the head backward. Breathing. Look, listen and feel for breathing. If breathing normally, place in the recovery position. If not breathing, commence CPR, 30 compressions to 2 breaths. Defibrillation. Attach a defibrillator as soon as possible and follow the prompts until the arrival of medical assistance.